Thank you, everyone, for being here again, for helping us spread the message. It's important, the work that you do, and I truly appreciate it all. So with me today are Minister Julie Green, Chief Public Health Officer, Dr. Kandola, and Territorial Medical Director, Dr. AnneMarie Pegg. Since the beginning of 2021, our government has been hard at work putting into action a vaccination strategy that has been one of the most aggressive campaigns in the history of the Northwest Territories. We have always said that our main priority during this pandemic has been to protect residents and communities, especially those that are most vulnerable to this virus. The efforts of our healthcare professionals who have helped vaccinate residents in all 33 of our communities, some of the most remote in Canada, has been nothing but impressive. The work undertaken by Dr. Pegg and the Northwest Territories Health and Social Services Authority is helping us to protect our loved ones and positions us where we can begin to look at life post-pandemic, which includes our social and economic recovery. However, I must continue to impress upon residents that even if you've had your first dose of the vaccine, our work is not quite done. It's important we don't let our guard down just yet. Even if a significant number of residents have been vaccinated, we still need to protect those around us who have not yet or cannot get the vaccination. While the vaccination plan is progressing as planned, we all need to continue to do our part and follow the public health orders, wear a mask, wash our hands, and keep a safe distance. As we have seen with the outbreak at the mine, it can only take a few cases to cause the need for strict measures to be undertaken. I want to thank De Beers Canada and Mountain Province Diamonds for their swift efforts to limit further spread of the virus, and I'm confident that they will continue to ensure that they are vigorously testing their employees and working to limit the spread of COVID-19. I also want to thank all of the businesses and residents who have continued to keep our residents safe. It is, however, not lost on this government that these are trying times for everyone. The pressure of the pandemic is placing on residents and businesses is apparent, and pandemic fatigue has been setting in for many of us. We are approaching the one-year mark since the beginning of the pandemic. It has been one of the most difficult times many of us have ever faced, and it has had an impact on personal and emotional well-being for all of us. This is a difficult time for everyone, and the increased pressure the pandemic has put on each of us should not be ignored. Self-care is so critical, so important, and I encourage everyone who may be feeling down to reach out to friends, to family, or to the N.W.T. helpline at 1-800-661-0844 for support. I've said it many times, but one of the lasting legacies of COVID-19 will be how we treated each other. And I encourage all residents of the N.W.T. to support those who are having a difficult time. We all play an important role to encourage a society where we can all talk more openly about how we're feeling. We need to work together to effect change around the attitudes and the stigma that exists, and this starts with being kind to each other. I'd now like to turn it over to Minister Green to provide her opening remarks. Thank you again for what you do to spread the message.
My mask stuck on my earrings. Okay, let's take my earring off. Morning, everyone. Thank you, Premier Cochrane. I'd like to begin with a brief update on the COVID-19 vaccine rollout in the Northwest Territories. As of February the 15th, we've delivered 13,578 doses, first doses, and fully vaccinated 579 residents against COVID-19. The N.W.T. is still leading the country in the delivery of first doses. These doses are already giving strong protection to 39% of our adult population. We're eagerly awaiting the fourth shipment of the vaccine later this month. More vaccine will allow us to continue bringing first and second doses to N.W.T. residents. Since the beginning of our vaccine rollout, we knew that the allotment and the delivery of doses were both outside our control. Our team has built a flexible vaccine schedule to account for shipment delays, weather, and other logistical challenges. As I've said before, the federal government has remained strong in its promise to deliver enough vaccine for 75% of the N.W.T.'s eligible population by the end of March, and we are grateful. We will continue to keep the public informed through media briefings like this one and on communications channels online, on the radio, in print, and in person. Residents can check the vaccine schedule at www.nthsa.ca/COVID-vaccine, or just Google NTHSSA vaccine schedule and you'll find the most recent information. It's updated several times a day, so it is your best source of information on the vaccine schedule. We are adding dates and communities on a regular basis. With our current supply, we've begun delivering doses to priority populations in our small and remote communities this week, as well as providing first doses to those individuals who may have missed or weren't ready for the initial visit. We're stepping up our on-the-ground communications during the second visits, especially in N.W.T. official Indigenous languages, to ensure we are reaching as many residents as possible. In order to help N.W.T. residents feel comfortable and informed about what to expect during COVID-19 vaccine clinics, we're also launching a new video series this week that features Clecho nurse Leanne Mantla and her mother, leader and elder Rose Mantla. Both Leanne and Rose are experienced healthcare workers from the N.W.T. whose trusted voices explain what to expect before, during, and after the clinic arrives in the community. Residents will be able to find these videos in English, French, and Clecho on the GNWT corporate Facebook pages or on the website. On the website, the public will also now find wastewater test results. The GNWT has updated the COVID-19 dashboard to display wastewater results by community and all results from the time sampling started. There are currently 6 N.W.T. communities where wastewater surveillance is being conducted. They are Fort Simpson, Fort Smith, Hay River, Inuvik, Norman Wells, and Yellowknife. The Chief Public Health Officer has implemented a wastewater surveillance program in these communities to help detect the presence of COVID-19. Testing wastewater is an effective way for us to figure out whether the virus is present in an early warning system to detect COVID-19 in the communities. The program will be in place for the next 6 to 18 months, depending on the status of the pandemic and the role this surveillance activity has in informing the response by public health. The testing is a collaboration between community governments, the Departments of Environment and Natural Resources, Municipal and Community Affairs, Health and Social Services, and the Public Health Agency of Canada, including the National Microbiology Lab that is located in Winnipeg. I'd now like to make a few more points about where we're at with COVID-19. First, I'd like to acknowledge, as the Premier did, how much N.W.T. residents have sacrificed in the last 11 months to protect our territory from COVID-19. As March break nears, I know many people would like to travel outside of the territory. Transmission rates across Canada are still high, and the impact of variants is unknown because what we do know is that they are more infectious than the original strain, but we don't know all the places that they exist. As a result, non-essential travel outside the territory is not recommended at this time. Let's take time to see how much there is to do right here in the N.W.T. Get out on the land, go skating, go cross-country skiing, snowmobiling, ice fishing, snowshoeing. This is the best month in the north. If you must travel, Awareness is key. There are currently significant outbreaks in many areas where N.W.T. residents would routinely travel for medical and other reasons. Knowing the COVID-19 situation in your destination before you travel will allow you to make informed decisions about your health and safety. Residents can find travel advice and more information on COVID-19 hotspots in nearby regions and the rest of Canada on the same N.W.T. COVID website. So far, the COVID-19 cases in our own territory have been contained because Northerners are taking the proper steps to keep their community safe. But we have seen how quickly one case can become an outbreak. We must continue to follow the guidance that has kept us safe these past 11 months. Keep gatherings small in spaces large, practice physical distancing and stay 6 feet or 2 meters apart. Wash your hands a lot. Keep your sneezing and coughing to yourself. Wear a mask to help keep you and others safe, and get tested and stay home if you're feeling sick. Together, we can defeat COVID-19. And I'd like to thank Chief Public Health Officer Kandola and the Territorial Medical Director, Dr. AnneMarie Pegg, for joining us here today and helping us to answer your questions. Thank you.
Thank you, Minister Green. So we'll now open the floor to media. Same process as normal. One question, one follow-up to each reporter as I call on your name. If you'd like to remove your mask to be nice and loud, that's fine. Please just keep your distance and speak nice and clearly. So we'll start this morning with Emily from Cabin Radio.
Yeah, my question is how many people will need to get vaccinated in the territory to hit the 75% target?
So the total number of eligible adults in the Northwest Territories is 34,400. So 75% of 34,400 is roughly over 26,000. Thank you.
And as a follow-up, how many vaccine doses are in the fourth shipment?
Right now, we can't confirm the actual number in the fourth shipment. What we can say is that Canada has been confirmed by Moderna that we will receive a fourth shipment, and it'll be in the week of February 22nd. And once we receive that shipment, we can provide that exact number. Thank you.
Sarah, CBC.
My question is about the Gotcha workers. I understand there's some isolating in Yellowknife. I'm just wondering where that is and if it poses any risks to the public.
So on February 3rd, we announced an outbreak at Gotcha mine. To date, we've had a total of 15 confirmed cases of COVID related to that outbreak. 8 are N.W.T. residents, 7 are out-of-territory residents. 3 have already recovered, so we have 12 active. All the cases are isolated, and in the for the ones isolated here, we have about 110 people isolated in Yellowknife, of which the vast majority are N.W.T. residents. They are safely isolated and separate from each other. It's our belief that these cases originate from an exposure and people were incubated and being through regular testing that we're picking up these cases. We are now on day 8 of isolation, so we'll continue to monitor until we complete the full 14 days of isolation.
Follow-up?
Not really, but can I ask you a question?
Yeah.
I have another question then. We understand that teachers will be given priority for the vaccine when the bigger rollout happens in the larger centers. I'm just wondering if there's been any change to the status of teachers. We heard MLAs last week asking if they could be declared essential workers.
So the good news is that the National Advisory Committee on Immunization have released their recommendations on sequencing for vaccine populations. And in stage 2, any frontline workers who cannot work virtually would be considered a priority, and that also includes teachers. So in the larger regional centers, we will be prioritizing teachers among other frontline workers who cannot work virtually. to receive the vaccine ahead of the rest of the general population, and this will be in the beginning of March. With respect to teachers are requesting that around the essential workers, when people are traveling out of territory and return, they have to submit a self-isolation plan. Teachers are still required to self-isolate for the full 14 days. Whether they're essential worker or not, this doesn't change the fact that they will still be required to isolate for the full 14 days after they return from out of territory. In the N.W.T. and across the world, the one population that is not eligible for the vaccine are populations less than 16. If you have a Pfizer vaccine available, populations less than 18 in our scenario, because we only have the Moderna vaccine. So this is still a susceptible population. We have, in our Emerging Wisely, have allowed increased number of students, especially in the elementary school, without requiring the 1 to 2 meters of physical distancing that we require for middle and high school. These are bubble scenarios where the students are able to go to school daily, be protected from any sources of introduction of COVID. And I'm proud to say that in N.W.T. we haven't had any school-related outbreaks. To maintain that sense of protection, we still require anyone traveling out of territory to isolate for the full 14 days before they enter a school environment. Thank you.
Kevin, Sheer North.
Is there any way we can get a more detailed breakdown of the 579 people that received the second doses? Because the last time it was like 25 people, we knew it was from 2 of the senior homes. So who exactly are the people that have gotten the second doses?
Dr. Pegg.
So I can't give specific details, but as you're aware, the priority for the second dose was the most vulnerable people, and those are residents of long-term care facilities and the staff that are caring for them. And the majority of the 579 people that have been fully vaccinated now fall into that category. So they're long-term care residents and the staff that are caring for them.
Do we know when the mod workers will be getting their second doses?
So as we have more information about the arrival of vaccine supply, we're looking at the timing of second doses as it corresponds to people who have received their first dose. And there will be clinics that will be opened up for those priority groups that have received first doses, in line with the timing to receive a second dose that at this point is looking like we won't have any problem falling within the 42 days that is recommended by the National Advisory Council on Immunization. So people should update or check the updated website, because it is updated frequently, and there is information regarding timing for second dose clinics for people who have received a first dose already.
Okay, thank you. Blair, ending us up.
Yes. So will the delay in the arrival of the Moderna doses affect the vaccine rollout for the general population in March?
So I'm pleased to say that the fourth shipment is not delayed. The fourth shipment is arriving right on time, which is the week of February 22nd. And once we receive that shipment, we're not anticipating a delay in a vaccine rollout.
Nothing further?
Yes. Yeah.
Okay.
So is there any update on the latest research on what happens if the 42-day window for the second dose passes?
So when you look at the UK and Quebec, they have introduced a 12-week window from the first dose to the second dose. And so there is some promising research coming out of Quebec, but we have to wait for that to be formalized. But what we do know about vaccines is we have very good research coming out of Israel about the effectiveness of the first dose and the second dose. And we have the National Advisory Committee of Immunizations have looked at the data, specifically for Moderna. 14 days after receiving the first dose, your it has a 92% efficacy. That efficacy, based on the Moderna clinical trials, is they have data up to the 42nd day. What we do know about vaccines and immune response is that we don't anticipate there to be a drastic reduction in immunity on day 43. It's typically a slow waning. Still waiting for more information as the days are continued past the first dose on the level of immunity, but in the N.W.T. we can be reassured that we will meet the 28 to 42 day window, and even if people, for reasons related to their own schedule, miss that window, they can receive the second dose after 42 days, and it would still provide an excellent immune response.
All right, thank you, Dr. Kandola. Mariah, CKLB.
Thank you. This question is aimed for Dr. Kandola or the Premier. Do you plan on enforcing any more stricter policies or protocols for the Gotcha mine with the bears in general, or do you think what's been done is enough, considering this is one of the larger outbreaks that we've experienced?
Dr. Kandola.
So my team have been engaging with extensive discussions with the Gotcha mine, and more in-depth discussions around infection prevention control, around their screening process, and also encouraging having a insight visit by industrial hygienists. So these are things that we have proposed to Gotcha mine. At this moment, they have done everything possible to try to minimize the impact of the outbreak. The moment that we had an increase in cases, they went into care and maintenance. 1/3 of their workers were repatriated out of the territory, 1/3 in Yellowknife, and then the 1/3 that is on site have more stringent isolation measures and are separated from each other, and so they're undergoing regular testing, but we're trying to minimize as much exposure as possible.
I guess to say it simply, is it enough what we're doing at Gotcha mine?
We're doing as much as we can. The one plea that I have for our N.W.T. residents is that a significant portion of people who work at mines are from the N.W.T., and they do have the ability to be vaccinated. This particular virus that we saw at the GK mine was not a variant of concern. We have looked for that, so it's not a highly infectious variant, but we are encouraging every rotational worker who's from N.W.T., not just for Gotcha, but for any other closed camp, whether it's a Caddy, Diavik, or if you work in oil and gas. You have the opportunity to protect yourself. Please protect yourself and get vaccinated. Thank you.
Thank you, Dr. Kandola. Marie Soleil.
Yeah, it might be for you again, Dr. Kandola. So the outbreak at the mine was under period. How long do you think that the measures will stay at the mine for isolation and the 130 workers over there and so on? Since it's like 2 isolation normally, do you expect that the measures will be lifted soon, or?
So 1/3 of in the current outbreak, 1/3 of the workers were repatriated out of territory, and they're expected to isolate for 14 days. Another 1/3 were repatriated to Yellowknife. The bulk of them were N.W.T. residents, and so they're completing their 14 days, and then they will get vaccinated. And the 1/3 on site are also undergoing 14 days, and then we're watching to see if there's any subsequent transmission or any new cases. And the plan is to, if the mine is to undergo resume operations, we'd have to swap out the entire cohort that were exposed and bring in a new cohort that have not been exposed to the virus. Hopefully, a significant amount of them will be already vaccinated, and we would anticipate that once that occurs, that no one coming in would be at risk from the old scenario of the original outbreak.
Maybe
So 14 days won't be completed until next week. And so we continue to do more testing and following all the people in isolation and the people at the mine. And so if we are confident that there hasn't been any further exposure, the safest thing is to remove the current cohort and bring in a fresh cohort, because there will be no ability to cross-expose. And if they would have completed 14 days and have gone on rigorous regular testing, and the people isolating here will have completed 14 days. And so if they haven't developed COVID, they're out of the quarantine period. But we're also, in addition to that, we're vaccinating all our N.W.T. rotational workers.
All right, thank you, everyone. That's actually all the time we have this morning for our regular briefing. As usual, if you have any follow-up questions, you each know your departmental contacts, or of course you can email press secretary at gov.nt.ca. Reminder to continue to check the vaccine schedule regularly as it is updated as new information becomes available. And we'll leave it there for today. Everyone have a good afternoon and a good week. Thank you.